All right, hello everyone. I know some people are still popping in. I am Gloria Hall. I'm the Rap Senior Editor for Publications, and welcome to the meeting for our hot off the press new edition of Global Medical Device Regulatory Strategy. We're very excited that it's here and ready for the regulatory community. I'm going to give you a little bit of background on the book really quick. It's almost 100 pages, 22 chapters. We had 30 authors from 6 different countries. And we're lucky today to have the 2 lead editors, Peter Takes and Susumu Nozawa. So I would like them to give a little bit of background about what they do and their participation in RAPS, and then talk about the revision of the book and what's new and how you can benefit from it. So Peter and Susumu, I'll turn it over to you.
Okay. Well, I'm Peter Takes. I've been a member of RAPS, let's just say, for a long time. I've been on the board of editors for a considerable amount of time as well. I'm currently lead medical device section editor for the board of editors. I'm RAC, and I'm also a fellow of RAPS. I've been a fellow since 2011. This is, I was editor-in-chief of first edition as well. By the way, if anybody has their mic open, could you please close your mic?
I've got one of these videos.
Yes, can everyone please
could you please close your mic if you're not asking questions? Thank you.
Yeah, and then if you have questions, we can pose those after, but if everyone can mute because we're getting lots of background noise. Thank you.
So I worked on the first edition of this book, and I've been editor of Fundamentals, US Fundamentals before, and this is the 3rd book I've worked on, and so I'll stop there before I talk about the book and let Susumu introduce himself.
Okay, great. Can you hear me okay?
Yes.
Okay, great. Yeah, nice to meet all of you virtually. Yeah, my name is Susumu Nozawa. I'm head of regulatory policy at the Siemens Healthineers. I have been with RAPS for many years. I did board of directors and the president and also chairs. And then I worked on a few books from RAPS, Fundamentals for Japan, and also terminology books. And then this opportunity came to me to work on this great global medical device strategy book. So I had privileged to serve as editor-in-chief to make this already great book better. So.
Okay, so just to give you a little bit, and then we're going to open up to questions. You know, the first edition of this book, which was excellent in its presentation of the material, was very well received and really made us happy at the time of its publication in 2016, and throughout its existence, it's been very well received. But as everyone's aware, technology advances, and with it, regulations and requirements, and so in this context, a lot has evolved in the medical device industry over the last 4 years. So we were compelled to put together a new edition of Global Regulatory Strategy for Medical Devices. Potentially new regulatory requirements might likely need a rethink of regulatory strategies and project plans or product plans. But with these changes, the basic tenets of regulatory affairs stay the same. You know, we still, things like GMP, GLP, GCP, quality systems still remain the foundation of this book and the foundation for the book. Some of the chapter authors, as Gloria mentioned, have changed, many returned, but all you will see were carefully chosen as recognized leaders in their field. You know, Susumu and I sat down and meticulously went through some of the author changes and picked people that we thought could address the topics very well. So the overall design of Global Device Regulatory Strategy was to be a book that can equally serve as a textbook for new regulatory professionals and as well as regulatory collegiate courses. And then also it could be a common daily reference for regulatory departments worldwide. So Susumu, do you have anything else to add about the book before we open to questions?
No, not much to add. When I look at on the first edition, there was, you know, there were already great content in very, very detailed manner. But from my point of view, what was lacking was to something to bind all of the, you know, all of the content together to see the whole picture. So, so I suggested Peter to why don't we create, you know, talk about the overall scheme of the market access. So we created a new chapter, which is the first chapter on this book, new edition. So I believe, you know, we believe we could improve that content of the book a little bit better, and also can provide, you know, overall picture of what needs to be done for successful commercialization.
So with that, I mean, we're going to open it up and see if anybody has any questions. If you have any questions, you know, open your microphone. If you want to open your video too, certainly do so. But you know, we're mostly here to answer your questions about the book, or we can answer your questions about being an author. You know, even beyond just the book, if you want to ask questions about being an author, I think it's for things like focus, Gloria, I think that's okay for them to do that as well. And, you know, like I said, I've been on the editorial board now, okay, I'm going to age myself, but probably pushing 20 years now. I've been on the editorial board for RAPS. I've written for Focus. I've written for multiple books of RAPS. So please, if you have any questions, you know, Susumu or I or Gloria will try to answer those questions for you. So let's open it up. Anybody want to jump in? And Wendy said, feel free to use the chat too. You can do that as well. Nobody has questions about being authors or anything to that extent?
I have a question. This is Meredith.
Yeah.
Deciding on the information to include for a particular chapter, there's always way more information than you can actually include in the chapter itself. How do you decide what is priority for inclusion?
Well, you know, we kind of, our approach was to leave it largely to the authors of the chapters, and the way, because as you could figure, this is a monumental task. I mean, this is putting together this book and keeping up with all this information is a monumental task. So we try to go with subject matter experts in all of these areas. We had the advantage of starting with a very good book this time, and we said, you know, to the authors, take a look at the content in there, tell us what's relevant, tell us, you know, what should be changed. And ultimately it comes down to, you know, it came down to Susumu and I. You know, Susumu and I both reviewed the chapters as they came out, but I can think of very few chapters that we looked at that said, no, that doesn't need to be in there, you know, or you know, there were a couple chapters where we said, okay, you know, this is great, but we need a little bit about this in here, and kind of pushed it back to the author and said, okay, give us, you know, a little bit more on this. But Susumu, correct me if you could think of anything, but I can't think of any chapter where we really said, oh, you know, you included stuff that doesn't belong in here. We really didn't do that. So I think it's pretty much, for us at least, it was up to the chapter authors to tell us what they thought would be in there. And then we used our combined expertise to make the decision of what was relevant and what made the book more robust. Susumu, anything to add to that, or?
No, that's pretty much the direction and approach we have taken. We listen to what each author has to say, and then, you know, some chapter, you know, one of the tasks we did was to level the depth of each chapter. You know, some chapter had a very deep, very detailed description. But to look at, you know, overall the depths and also overall scope of this book, we may need to listen, you know, the depths of the you know, specific chapter. So we worked with authors, and then we modified a little bit so that it's you know, pretty even.
And you know, there was a lot of, you know, in reading this too, I mean, one of the things that I love about being editor of the book is, you know, I learned so much in reviewing these chapters. You know, I'll read a chapter and say, oh, you know, I didn't think of it that way. Okay. Or I'll, you know, in some cases, oh yeah, I forgot about that piece of information. It kind of builds up my foundation and helps me to, you know, rethink through some things that maybe I hadn't thought about for a while, and see something and say, oh yeah, you know what, I missed that. Or Susumu would say, oh, you know, we should do this perspective, this chapter. And yeah, that's a good idea. You know, take a different approach because of the way the industry's changed, or, you know, the way it's being addressed now gives us a little bit perspective. So, you know, those of you that have the earlier version of the book, you'll see some things that look the same. You know, like one of the chapters that I authored, non-clinical laboratory testing, and I did it with a co-author, and there's, in terms of non-clinical laboratory testing, there wasn't that much new to really introduce. Non-clinical laboratory testing doesn't change that much other than requirements. You know, some requirements increase, but in terms of what you would actually do to execute that, hasn't changed that much. A stability test is a stability test. You know, a biocompatibility test, excuse me, is a biocompatibility test, and so on.
Yeah, one of the things I would add to that is that, you know, global regulatory landscape is changing. You know, US is changing, European, you know, EU is changing, and everybody is changing at a very, very fast speed. So one of the challenges we have faced is how to freeze, you know, all of the regulatory changes and going on in a dynamic manner at a certain point. So if you look at the regulatory landscape now, you know, a year from now, it might be a little bit different. But this is the nature of a global regulatory landscape. So we hope we could give audience, the reader of this book, some you know, overview of current regulatory landscape.
Hi, I have a question. My name is Cheryl Skinner. There's been several white papers in the past couple of years, or last year or so, that came out regarding the potential paradigm shift for 510K submissions in the US. Did you discuss this or have you addressed this in any way? Do you have any more information in regards to that?
I think we may, if it's basically, if it's talking, if there's a discussion about a paradigm shift, we generally are probably not going to address this because this is a kind of a current status textbook. A lot of these chapters may basically address, I don't remember a specific chapter of that without going back and looking at the book. But a lot of the things like that, you have to remember too that the book is written at, and kind of to what Susumu said, it's written at a point in time. And we look at it, we go forward with a certain amount of forward-looking vision, but it's basically, this is how it is in this point in time. And so we might say in a chapter, and I don't recall specifically if we did it in that chapter or not, but we might say, this is how it is now. And if there's a real inclination to change that paradigm, then we might say towards the conclusion of the chapter, a little section on these are what the mode of thinking is going forward. These are the things that might change in the next 2 years before the next edition of this book comes out. We can't really be soothsayers and say it's going to happen, it's not going to happen. So we just try to cover it as best we can while fixing what the status of the industry is at this point in time. Does that answer your question?
Yes, thank you very much. I know it's a difficult challenge to try to project into the future, but I appreciate it. And
it's hard, and we did have actually probably a few things come up that we said, well, we're reading this now, and in 6 months it may be this, but really where we were at is, well, this is where we are today, and the point of the book is, and I teach courses in regulatory affairs at the collegiate level, and if I'm going in a classroom, I'm going to say, this is the way it is today. And so, I'm not going to talk, I'm going to talk about, because as we all know, particularly when we see something like FDA guidance, the guidance pops up and, 2 years later, they say, never mind. And, and we never see any of that topic again. And one of the things I can give as an example for that's immediately sticking in my mind, because I had some recent questions about this from someone, is LDTs. FDA came out with guidance back in 2014 or 2015 about LDTs, and now we're 4 or 5 years later, and a lot of the things that they're saying never mind. So to put that in a book and say this is the way it's going to be is it would have been a mistake. So
agreed. Thank you so much.
Sure. Is there any other questions? Nobody's talkative this morning and filled with inquiry and fascinated by our upcoming, or our book that just got published Thursday, right, Gloria?
Friday, yeah. Thursday, Friday. It's still wet, I think, from the printer. There is a question in the chat, Peter and Susumu.
Yeah.
It says, reviewing the chapters, I see standards are included in the book. Are common specifications discussed? If not, why not? So are common specifications discussed in the book?
I'm not sure they mean specifications that are cited in those standards. Would that
so that
be
was from Tiara Brown. Is Tiara, can you clarify if you're still on the video?
Can you guys hear me?
Yes.
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 Can you hear me now? Okay,
Yes.
sorry. technically challenged. No, I know that under Europe's new MDR, like common specifications are going to go hand in hand with regular ISO standards. I was wondering if you guys kind of gave that some thought and kind of decided to put like a little blurb in the new second edition stating how those common specifications would impact regulations and registrations in Europe.
We might have touched on that, but since European regulation is such a dynamic topic at this point, we might have not got into too much detail on that. I realize that that's a very important topic for product registration, but I need to go back to the book to read how much detail we went into.
I could say, you know, to some degree, I think we did address that directly. Again, you know, and I've read all these chapters, but the one that I know most intimately is the one that Dorota and I wrote. And I could say there are a few things in there, and maybe this is, I think this is what you're shooting for. There are a couple things in there that we said for non-clinical testing, this is the, for example, maybe for biocompatibility, we said this is the type of, you know, sensitization testing that you would have to do for biocompatibility, and it's the same whether you use FDA guidance or whether you use ISO or whether you use, you know, some other standard. You're always going to have to do this type of biocompatibility testing. And so, excuse me, in the context that you're asking, I think we've addressed it from periodically in the chapters to say, you know, FDA, here's the standard that you would follow under ISO. Oh, and by the way, you know, FDA recognizes this standard too. So that kind of gives you, I think, the kind of crossover that you're looking for, that the reader would then look at it and say, okay, I need that standard, because whether I have my product coming out in the US or somewhere else or Canada, I'm always going to need that particular standard. So we do make that kind of statement in many places to say, yeah, you know, this is the standard that you're going to have to think about no matter who you do this for.
Thank you very much, Peter. I'll make sure I get my copy of the book today. I'm
I hope so.
interested to read that chapter specifically. Thank you. I appreciate you guys.
Thank you for your comment.
Anybody else have any questions they'd like to ask? You can chat. Gloria's watching chat, I guess. Is there a discount on the new book? Somebody asked. Gloria, that's for you.
The book, the convergence rate for the book is $100 till the end of the event. And it's a book that for reps members is typically $125 and for non-members $175. But for convergence release, it is $100. So, and it's available in the rep store. And you can get to the store from the event platform under Rep Central, and then go to the store, and you can purchase it via the Reps Convergence store. Do you see any other questions? Oh, yeah. Jen's answering questions also.
If anybody has any questions, just jump in here.
Hello, this is Avelina. Can you hear me?
Yes.
Yes.
Hi. So I am looking into getting an RAC for the medical devices, and I see that there's the fundamentals textbooks and then your textbooks. What's the major difference between your textbook versus the fundamentals?
Well, the fundamentals are and is all for U.S. regulatory affairs. So the fundamentals are broader, and you know, the fundamentals are going to cover drugs and devices. It's fundamentals of U.S. regulatory affairs, and I don't have I don't have the latest edition of fundamentals here. The last one I have is the 8th edition, but it covers all ranges of U.S. regulatory affairs, and where our book just covers medical devices. And so where I think it would be, you know, like when I studied for my RAC, again, many years ago, we'll say, but you know, I've been device-based. That's my strongest foundation. And so when I studied, I you know, got together with people who were drug people that needed device help, and I helped them, and they helped me. But so the device book is going to help. Our book is going to help you with the device side. Or fundamentals book is going to help you with the broader regulatory perspective. Wouldn't you agree, Susumu?
I think the reps now offering device and the drugs, right? Pharmaceuticals.
Yeah,
Right.
there's a fundamentals of medical device.
Yeah, that covers the entire globe. I think. I'm sure there the you know heavy emphasis on
I can
US,
jump in here.
and
So
also- yeah.
the fundamentals of medical device regulations are also fundamentals. We actually have US fundamentals, European fundamentals, international fundamentals, Canadian and Japan, but they have not been updated recently. So fundamentals of medical device regulations are all of the medical device chapters from the global fundamentals books. So it's the medical device chapters from US, medical device chapters from Europe, medical device chapters from international, medical device chapters from Canada. So it's a collection of the medical device chapters from the fundamentals books.
Okay, I had forgotten
Then we
that.
also do sector pubs where, no, I think I actually covered that. So and then we also do biopharmaceutical subset, which includes all the biopharmaceutical chapters from the fundamentals from the 4 regions. So I hope that answered your question.
Yeah, I think it helps understand what the other book has, and then this global regulatory strategy, it just has additional topics. Is that correct?
Yeah, for the most part, yes. Yeah,
Thank
so,
you.
you know, ours is, yeah, ours is, it's centered around a direction towards, you know, taking a product start to finish and setting up, just like it says, a strategy where, you know, fundamentals are giving you the basics. And here's the basics of how you would approach this. Where our book is designed of, okay, you want to do a strategy from start to finish with your product. I want to market in the US and I want to take it global and so on and so forth. And that's what we try, and here's all the things that you need to address. That's where we try to go with this.
Thank you.
Other questions anyone might have? So, you know, hopefully some of you are thinking about being authors. It's a good way to get yourself exposed, and especially if you're new to the industry and or new to regulatory affairs, or have gotten more experience in regulatory affairs and want to, you know, get your exposure more. It's also good for, you know, RAC points if you have your, you know, if you've got your RAC and you need to get your CEUs in for your RAC recertification. And so I really encourage you to start looking at these opportunities, you know, for Focus is pretty open to just about anybody in the field, no matter where you are in the status of your career of writing articles for Focus. We're you know, as Gloria's nodding yes, but I mean we're always striving to find Focus authors, you know, we publish ahead of time what different months and topics should be, but even for books, like when our book first came out and we decided, you know, we knew we had to change some authors, RAPS put out a notice that said authors are needed for this textbook. And so I encourage you, when you see a solicitation like that, to slip, you know, send in your name. I mean, we got, you know, for our, I think when we put out that solicitation, Susumu, what did we get? Probably about 15 different people saying, you know, I can author, I'd like to be an author, I'd like to be an author. And so we, you know, you send in your CV, you send in your background, and I forget what else they asked for off the top of my head, but you know, we scrutinized a lot of wonderful people, and quite honestly, you know, it was actually at the last convergence that we did the final. We still had about, about 5 chapters to fill, or 6 chapters to fill. Mm-hmm. And we sat down for about 2 hours and just screened through these potential authors, and we really had a hard time of picking 5 or 6 people, because there were excellent people in there, and it you know, it came down to very tiny things that we made the selection, because and it had, for most of them, I would say, it had nothing to do with, you know, a lot of people say, well, I've never written before. Well, for most of them, it had nothing to do with, had they ever authored something before necessarily. You know, if they did, that's a plus, but it was just about their experience and you know, their interest, and the main thing for me is interest. You know, are you really interested where you're going to put the work in and write this? And you know, and as you're writing it, you know, we had a few new authors in this book, and you know, as you're writing these things, you know, we were getting calls, and Gloria was getting calls, and I was, and Susumu was, that said, hey, you know, I need help. I'm not sure exactly how to deal with this. You know, how would you like me to approach this? And we all got on a conference call, and you know, Susumu threw out some ideas, and I threw out some ideas, and you know, we let the author kind of figure out how they wanted to approach it. But we kind of, you know, if it was someone who had a little less experience as an author, we worked to kind of help them through the process, and the results we were thrilled with. So.
Right. And I can't stress that enough. I mean, we have many opportunities to volunteer with RAPS, especially in the book side of RAPS. We have chapter writers, we have lead editors like Susumu and Peter, and we have reviewers, in addition to our regulatory focus online magazine that we're, you know, constantly looking for authors and people to suggest topics. So, but keep in mind that with the strong leaders of each book that we have, and my assistants, we work with you throughout the process. We work collaboratively. I mean, it is a truly collaborative effort, and we offer you assistance. But I will say it is a commitment. I mean, it's a 12-month at least commitment, sometimes longer. So there's a lot of hours that go into it, but between the leads and myself, we work with you throughout the process, and we can, you know, especially if you're a new writer or a new contributor. So, but our time is up for this session, but I would encourage, if you have additional questions, email them to me, ghall@raps.org. And I can get those to Peter and Susumu. If you have any questions about contributing, upcoming book projects, visit the store. I will be at the store at the break times. We can have a video chat, but we have many projects coming up. We're going to redo International Fundamentals and release it in 2021. So I will be looking for chapter authors and reviewers for International Fundamentals. And a bunch of other topical books. So if you're interested in contributing, have any additional questions about global medical device strategy, send me an email or come by the bookstore while Convergence is in session. Like I said, I will be there at all the break times. So I'd love to have a chat with you. But Peter and Susumi, thank you. That was
Oh, thank
really
you.
happy with the session
Thank you all.
and the information and the participation. We had upwards of 90 people attend. So that is, thank you.
Wonderful. Thank you all for
Appreciate that.
attending.
We have another Meet the Author session tomorrow for the Global Biomedical Device Strategy book. And I can tell you what time that is right now. I think it's at 11 to 11:30. Jen, are you listening to me?
am, and it is at 12:30 to 1 o'clock tomorrow.
12:30. I found it on my app. 12:30 to 1 tomorrow. You can meet the authors of Global Biopharmaceutics Medical Device Strategy, not device strategy, regulatory strategy. Sorry, I'm trying to talk too fast. So, but again, stop by the bookstore. Jen and I will both be there, and we can answer questions related to upcoming books, what we have in the store, etc. So. And again, send any questions to me. Thanks, everybody.
Okay, great. Thank you.
All right, take care,
Peter and Susan,
everyone.
you want to stay on for just a second?
Sure.
Thank you so much.